Hello everyone and welcome to my channel, Body Mind Healing. My name is Maria Sanchez. I am the author of the book Through the Storm, and my background is in holistic health, family practice, psychiatric mental health, and doctoral nursing practice. The case for today is premenstrual dysphoria, when PMS feels like emotional collapse. In dysphoria, we experience a deep state of emotional unease. It is more than sadness, more than irritability, and more than having a difficult day. Dysphoria can feel like being uncomfortable inside our own mind, our own body, or our own life. It can bring a sense of agitation, despair, heaviness, emotional pain, or inner disconnection that feels difficult to explain. A person experiencing dysphoria might be functional on the outside while inwardly feeling overwhelmed, unsafe, restless, hopeless, or unlike themselves. Premenstrual dysphoria refers to this kind of emotional distress when it appears in the days before menstruation and improves once the period begins or shortly after it starts. For some women, the premenstrual phase brings mild mood changes. For others, it brings a profound shift in mood, thoughts, body sensations, and sense of self. A woman might feel suddenly anxious, tearful, angry, rejected, panicked, depressed, overstimulated, or emotional raw. Small problems can feel enormous. Ordinary responsibilities can feel impossible. Relationships can feel tense. The body can feel swollen, painful, exhausted, or inflamed. The mind can become flooded with thoughts that feel convincing in the moment but do not reflect the person's usual clarity, stability, or truth. This is important. Premenstrual dysphoria is not a character flaw. It's not weakness, drama, immaturity, or lack of gratitude. It is a body-brain hormone pattern. The nervous system, endocrine system, immune system, sleep rhythm, stress response, and emotional regulation centers are all communicating. In sensitive women, the normal hormonal shifts of the menstrual cycle can create abnormal distress. The hormones themselves might be within a normal range, but the brain and the body can react to the change with intense sensitivity. The first step to deal with this problem is recognition. Many women suffer for years because they do not connect the pattern to their cycle. Tracking symptoms for at least 2 or 3 cycles can be very helpful. The question is not, how do I feel, but also, when do I feel this way? If the worst emotional symptoms reliability appear before menstruation and then lift afterwards, this pattern is crucial for diagnosis. Support begins with stabilizing the basics: sleep, food, dehydration, blood sugar, movement, light exposure, and stress load. During the vulnerable menstrual window, the body often needs more gentleness, not more pressure. Regular meals with protein, reducing alcohol, limiting excessive caffeine, protecting sleep, and lowering unnecessary demands can make the nervous system less reactive. Some women benefit from the consumption of magnesium, calcium, vitamin B6, omega-3 fatty acids, and other supplements, but this should be individualized, especially for women who are medication sensitive or medically complex. Emotional planning also matters. The premenstrual window is usually not the best time for major relationship decisions, harsh self-judgment, or life-changing conclusions. A woman can learn to reflect and say, I am in the vulnerable part of my cycle. I can feel this without obeying every thought it brings. This is not dismissing the emotion. It is creating enough space to respond rather than react. Journaling, therapy, grounding practices, warmth, quiet, reduced stimulation, and compassionate boundaries can help the woman move through the wave without being consumed by it. When symptoms are severe, professional care is important. Premenstrual dysphoria can become extreme when it includes suicidal thoughts, self-harm urges, rage that feels out of control, inability to function, or severe depression. Treatment options can include psychotherapy, cycle tracking, selective serotonin reuptake inhibitors, hormonal approaches, treatment of underlying medical conditions, and lifestyle support. The right plan depends on the person's history, body, risks, preferences, and sensitivity. But above all, premenstrual dysphoria deserves compassion. The woman is not too much. The suffering is real. The pattern can be understood, and with careful tracking, support, and appropriate treatment, the premenstrual window can become less frightening, less shame-filled, and more manageable. The goal is not to silence the body, but to learn its rhythm, protect its vulnerable seasons, and bring steadiness back to a system that has been crying out for care, respect, and consideration. If this message speaks to you, my book, Through the Storm, goes deeper into the journey of healing, faith, nervous system survival, and returning to the self. You can find it on Amazon under author Maria Piedad, DMP. If you like this video, like, comment, share, and subscribe to the channel. See you in the next video.